You're listening to the Food City Podcast, the show that takes you behind the scenes of your favorite supermarket.
From new products, expert tips on meal planning, and all things community, let's dive in and see what's in store today.
Well, hello, everyone, and happy 2025. It's hard to believe that the new year is already upon us. I'm Nicole, Food City Registered Dietitian, and I'm joined today by Megan Smith, Food City Pharmacist and Clinical Health Coach. And kicking off the new year, we thought it would be great to talk about the topic of food as medicine. Mm-hmm. And of course, the topic and the concept of food as medicine has been around for millennia, but it's really been gaining buzz in recent years, probably the past 5 or maybe 10 years or so. So we want to talk a little bit about what that means, what it doesn't mean, maybe some of the misconceptions surrounding nutrition, and just have a conversation. Yes. So starting off, how would you define food as medicine?
Food as medicine is you want to use what you eat to help keep your body healthy, manage, even prevent diseases. There's a lot of key ideas to it. You want to prevent diseases from happening by eating healthy. You can also help heal your diseases. Some foods can help manage or improve your health conditions, like improve your diabetes, improve even mood disorders like anxiety or depression. And then also just there's a personalized approach. Everybody's health needs are different, so you just want to make sure and find something that works for your lifestyle and fits you.
Yeah, I think that's so important that you mentioned the personalization aspect, because it's really, nutrition is not a one-size-fits-all approach. Mm-hmm. Our bodies are going to react to different nutrients and different foods and combinations of those nutrients differently. But those two key pillars of food as medicine from a preventative, so health promotion, promoting longevity and just overall well-being, and then to treat and maybe repair to a certain extent some of those diseases that are diet-related to diseases and situations where their bodies are responsive to changes in their environment.
Right.
And so why do you think there's been a resurgence in the interest around this topic?
I think people are becoming more aware of the connection between diet and chronic illnesses, and then also social media and increased access to information has helped people become more aware and more interested in this topic. But it's really important. You have to distinguish credible advice versus fads. Mm-hmm. So
yeah, that's so true. There's a lot of information and misinformation on social media. And even if you don't have social media in the form of diet books, I guess it's been around for quite some time, right? Magazines or celebrity diets, whatever that might look like. And so how do you think you balance between advocating for patients, for clients, for customers, for nutrition, while making sure that they're also adhering to their prescribed medications? Because I think people might hear food as medicine and think those two things are interchangeable, but in reality, they're not.
Right.
Food is food, and medicine is medicine.
Yes. I think the goal is to combine both. So food can work with your medications to improve your overall health, but that doesn't necessarily replace them. So, for example, a patient with diabetes who might have to take insulin can lower their insulin needs by eating a lower glycemic diet or, lower carbs, more fiber, but that doesn't mean that they should stop their medications without talking to their provider. So they work together to help.
Yeah, absolutely. And for a patient who might not be on insulin at that stage, we do know, unfortunately, that type 2 diabetes is a progressive disease. And so doing what you can in the form of nutrition interventions to help delay that progression, maybe even stop it to a certain extent so that insulin dependence doesn't become...
prolong it.
Yes, absolutely. And then how do you think pharmacists and dietitians can work together effectively? Because you talked about the importance of credible information, having people in your life, healthcare providers especially, who can distinguish between credible information and maybe some sort of fads or social media trend.
Yeah.
How can pharmacists and dietitians work together to more effectively advocate for their patients and work with their patients?
Yeah, I think if you have pharmacists and dietitians together, you get the best of both worlds. So you can have a pharmacist educate you on food interactions with your medications, and then a dietitian can help you develop meal plan or meal ideas that can work with you and work with your individualized plan with your medications that you are on. So you kind of get the best of both worlds when we're working together.
Yes, yeah. And I think always kind of advising patients to consult with the pharmacist, with their healthcare provider, their primary care provider, and with their dietitian so that we're all on the same page is critical. You mentioned the importance of distinguishing between those that credible information, and this touches, I think, on the importance of working with those healthcare professionals, consulting with their provider. But since there is a lot of misinformation out there, we know it's happening, and it's a big burden, I think, on patients, clients to be able to distinguish that themselves, especially when they might be seeing their primary care physician once a year.
Right.
If they're seeing a dietitian, let's say they have a diagnosis of diabetes, or a clinical health coach, maybe it's 6 times a year at most, but they're at the grocery store once a week
at
or
least.
more, at
Yes.
least, sometimes more, yeah.
Yeah.
And so what are some of those common misconceptions that you hear from patients about food and health, and what advice would you give to them?
I think one of the biggest misconceptions that we run into is all carbs are bad. And obviously they're not. Complex carbs are good for you. Healthy fat is good for you. So I think, you hear a lot about the keto diet or low carb diet, and they think, oh, all carbs are bad. I can't have fruit, I can't have this. So I think that's one of the biggest misconceptions that you have to try and educate and help them see that that's not true.
Yep.
And then also superfoods. People think there's a cure-all. Kale, acai berries. I mean, they're great. They're nutrient rich, but that's not. There's no magic cure.
Yes. Yeah.
So,
I 100%
and I'm sure you see a lot of that also.
Yeah. I think that's key. I think with any diet misconception, the trouble is that there might be a grain of truth to them. For example, with something like superfoods, we know that they might be very nutrient-dense foods that, as part of an overall healthy eating plan, can be really beneficial for your health. But it's not going to necessarily treat disease or even prevent disease when that's eaten in isolation of other lifestyle changes and an overall healthy diet. I think what starts often as good advice from a place of trying to simplify information for a patient can be taken too literally sometimes.
Yes.
A common misconception that I hear sometimes is only shop the perimeter of the grocery store.
Right. Yes, you hear that all the time.
Right. And I think the idea can be beneficial sometimes because the idea is to eat less processed foods, more whole foods that are more nutrient rich. And so the produce department is a great place to start with that. Meat without a lot of added preservatives and sodium and added sauces is going to be a great option. Dairy and the frozen aisle has lots of great options, but you're also missing out on so many nutrient-dense options in the center store.
Yeah.
Whole grains that are going to provide fiber, but also important micronutrients, vitamins and minerals that are beneficial for their health. And so not only are they nutrient-rich, but they're also very accessible oftentimes.
Right. Well, and then that's the big thing that I hear from patients who have a hard time following diets is there's like, oh, I just don't have the time to make things. I don't have time to prep. But then the middle aisles with the nuts and things like that also, that's a good on-the-go snack to take.
Yes.
So
Yeah, absolutely. And that's an unprocessed option, too. We tend to think of, okay, processed foods are in the center of the aisle, but that's not always the case.
Right.
You also have fruits and vegetables in there that you can get without added salt and added sugars, and accessibility and the time it takes for preparation, but also I think affordability can be a huge barrier.
Yeah.
And so how would you, or what advice would you give for somebody who just wants to kind of start incorporating these changes? How would you advocate for your a patient who's trying to get started?
I would say to start small. You don't want to feel overwhelmed, and I think a lot of people feel like it's just going to be overwhelming or expensive to try and eat healthier, so they just, reach for the frozen meal or something convenient that looks cheaper, but it doesn't have to be expensive. Just swapping out water instead of soda, or just adding a vegetable to a meal a day. Just small tips like that, something to help that you can sustain for a long time. How would you?
Yeah.
What kind of tips would you give?
Well, I think starting small is key because over time, it's like building a house brick by brick or
Yeah.
building a building, whatever, brick by brick. It's going to add up over time, even if that small, simple one change doesn't seem to be very fruitful and produce a ton of results. Over time, it really will. And you're going to get more confident and more empowered once you're able to sustain that one change
Right.
to be able to build upon that. So I think that that is key. Adding one more fruit or vegetable. I also think balancing your plate. So rather than avoiding foods or starting first in kind of elimination diets, what can you add to foods that you're already eating that are going to add more nutrition? You mentioned a fruit or a vegetable. I think that that's probably the best place to start because we know most people aren't getting enough fruits and vegetables in their diet. But also, does it have a healthy source of fat? Is there fiber? Is there color on the plate too?
Yeah,
Because
a
it's one
rainbow
thing
of
to have
colors.
a rainbow of colors, and we can maybe get into a little bit more of the reason behind that in a bit here. But I think also overcoming the barrier of budget. So what are some simple, affordable, cost-effective meal builders? I think beans and legumes can be a great one. Whole grains can be a great option. Finding frozen vegetables and canned vegetables that are more convenient and accessible for your family.
Right. Yeah, absolutely. I totally agree.
Yeah.
So what are some of the most powerful foods that you recommend for managing chronic conditions? Like if you have a patient that comes in that has diabetes, what are some of the things that you would recommend to them?
Yeah. Well, I think if we're getting into kind of more specifics, once they have a balanced plate, once we can see that there's a little bit of color, a little bit of fiber, you've got some healthy fats, you've got your protein in there, we can kind of get into more specifics of specific foods. And so one thing that we talk a lot about is antioxidants. You mentioned before superfoods, and while there really is no superfood that's going to treat diet alone, we know that antioxidants help to prevent free radicals from causing damage to our DNA.
Yes.
It can cause cancer and inflammation and other chronic illnesses that a lot of people are facing. And so we talked about adding color to your plate. The reason being is that those antioxidants tend to be richest in foods that are or fruits and vegetables rather, that are very like hyperpigmented, let's say.
Yeah.
So
That's a good way to put it.
for example, we hear a lot about dark leafy greens. So that's going to be rich in a variety of nutrients. Blueberries are noted, of course, for their very rich purple or blue color because they're rich in anthocyanins, which have benefits for blood pressure, also can help to prevent, again, free radical damage to our DNA. And then orange and red vegetables, too, are going to tend to be rich in the antioxidant vitamin A. What about you? What are some kind of specific foods?
I think for inflammation especially, the broccoli is a good one. And then spices like turmeric and ginger, just adding that to, if you like those spices, adding that to just what you are already eating can help with the anti-inflammation properties as well.
Yep.
And then you mentioned the berries and the dark leafy vegetables, and those are definitely my two go-tos, especially berries because they're so convenient.
Yeah, I think berries are one that you get one of the biggest bangs for your bucks when
Yes.
it comes to fruit in
And
particular.
they do have a lower glycemic index. So even for diabetic patients, those are the ones I would recommend over others just because it's got the lower sugar content. So.
Yes, yeah. All fruit is going to be great, but if you want kind of the biggest nutrient bang for your buck, berries are a great place to
And
start.
avocados are good too.
Yep, avocados. I mean, we talk about the healthy fats in avocado, the monounsaturated fats, which are beneficial for heart health, but also it's a really good source of fiber. I think a
Yes.
lot of people don't know that.
Yeah.
You get like 9 to 11 grams of fiber per one medium-sized avocado, which is a third of the day's value, even slightly over. So that's definitely a great one. I think you talked a little bit about inflammation and nutrients or components of an essential component of a diet that most people don't get enough of is omega-3
Yes.
fatty acids. And part of the reason is that most people are not meeting the recommended weekly consumption of fish. So fish and seafood, particularly fatty fish. So things like salmon, mackerel, and sardines. I think a lot of people maybe don't find those foods particularly appealing.
Right.
But omega-3s do have anti-inflammatory benefits. They can benefit brain health and heart health as well. So super, super important to get those in weekly.
So if you have somebody that you are trying to get them to have more omega-3, but they hate fish or they just can't stand the smell or taste of it, what do you tell them? What do you recommend for them to try and get that in?
Well, I think starting small with seafood, if they can get it in, would be ideal. So maybe fatty fish is a bridge too far. You don't necessarily like the smell. You don't find it appealing. So starting with any form of seafood would be a great tip, I think. So white fish, flaky fish tends to be a little bit more mild in flavor. Maybe shrimp or other types of shellfish can be a good gateway, or tuna fish. Canned tuna fish sandwiches can be a great option. Now, there are plant-based sources of omega-3s that are going to be great. They have tons of nutritional benefits. So things like chia seeds, walnuts, and flaxseed have omega-3s. Now, they have an omega-3 called ALA for short. I won't try to pronounce the whole thing, whereas the omega-3 found in fatty fish is DHA. Now, ALA doesn't... Small amounts, our body converts small amounts of ALA to DHA, but the conversion rate isn't super, super high. And so optimally, I think getting that preferred form in fatty fish is going to be ideal.
Gotcha. That's some great advice. And then olive oil, too, is, that would be the preferred. If you're going to cook fish or cook something, olive oil is the preferred way to try and get some more anti-inflammatory properties, too, isn't it?
Yeah, absolutely. Olive oil is going to be rich, again, in those unsaturated fats. You can also just eat olives. I think you're going to get a little bit more of the fiber, but you get those vitamins and minerals in there too. And then olive oil is going to be good for cooking at lower temperatures. I will say the smoke point is kind of low on olive oil, and it can be a little bit more expensive, which is why people tend to opt for things like canola oil or or vegetable oil. It's essentially the same thing with a different name. But something that has a higher smoke point that's going to have other benefits would be avocado oil. And so that can be a great cooking oil for higher temperatures if you're stir frying or something like that.
Yeah.
So specifically when it comes to something like diabetes, what specific foods are recommended? Let's talk a little bit about kind of the specifics, the nitty-gritty of what would be recommended for either treatment or prevention or just managing.
Yeah.
diabetes.
Well, you talked earlier about the plate method, balancing your plate. So I like to recommend that for diabetes patients. I'm trying to fill half that plate with non-starchy vegetables like salads, green beans, broccoli. It's going to have low carbs, but it also is high in nutrients, low in calories, and it's going to make you feel full.
Right.
And then the other half the plate, you do a quarter with the lean proteins, and then the other quarter with your starchy vegetables. And that helps balance it out. And the complex carbs like whole grains, quinoa, things like that are going to get digested more slowly because they have fiber in them, and that helps stabilize your blood sugar level. So anytime you can add that into it to kind of help keep your blood sugar from spiking or dropping, then that's always a beneficial option to choose. Yeah,
absolutely. I think the fact that it has fiber is going to be one thing that helps to slow that spike and stabilizes those blood sugars, but also the fact that you're eating other nutrients alongside that or protein and fat helps too. I think a lot of people don't necessarily know that, and we talk about the importance of complex carbohydrates, looking for fiber, things that are maybe lower in glycemic index.
Right.
And so they don't have as big of a effect on your blood sugar. But also another method would be to pair it with some protein, pair it with some healthy fats, because that's going to kind of blunt the insulin or blunt the blood sugar response.
And then we talk about the simple switches to try and improve your eating habits, just switching from like white, if you're used to white bread, to wheat bread. That's just one simple switch you can do there as well.
Yeah, absolutely. And it makes such a difference. I remember an experiment in college that kind of illustrated that, putting white bread in some orange juice compared to whole wheat bread and some orange juice, and the white bread just kind of disintegrates and becomes very mushy very quickly, whereas the whole wheat bread takes longer to break down. And so it's the same thing with our blood sugar and how slowly that's digested. White rice, brown rice, whole wheat pasta is going to be a great one. I think an easy option too would be oats. Yes. Oatmeal, they're going to be good for soluble fiber, which is beneficial not just for our blood sugar levels, but specifically for helping to lower cholesterol because it binds with those cholesterol and helps to lower that, so it's beneficial for heart health as well. Yeah, absolutely. Now, we talked kind of lightly on inflammation. So what sort of foods would you recommend for people with chronic inflammation, suffering from things like IBD, rheumatoid arthritis? Are there any specific foods or nutrients that you would recommend for that?
Well, like you mentioned earlier, the fatty fish, if you like it, the salmon, things like that, those are rich in omega-3, which can help reduce your inflammation. So anything that's going to be high in omega-3s, I mentioned the turmeric and ginger, they have anti-inflammatory properties, so adding that can help with that as well. And then berries and leafy greens, just going back to, there's a common theme, going back to the certain foods like berries, leafy greens, they're anti-inflammatory properties, so it's going to help out in just a multitude of ways if you can incorporate those into your diet.
Yeah, I think I love that, kind of just talking about the whole picture and maybe some of the underlying causes of those conditions and people who suffer from those conditions. Because especially I think of like with IBD, you've got ulcerative colitis or Crohn's disease, and a lot of the focus I think becomes in elimination diets and what foods should you avoid because people have different tolerance levels and of course different severities too will require different treatments and different kind of nutrition therapies. So if there's a flare-up with something like IBD, of course, you're going to recommend to reduce the fat intake, reduce some of the fiber, and they can kind of cause pause, like, oh, wait a minute, you're telling me to eat these fatty fish, lots of fruits and vegetables, these foods that are, you're saying, anti-inflammatory, but I've been told to kind of remove those. But in reality, the goal when that is in remission is to increase those foods with health promoting properties. So maybe some healthy fats, definitely some fiber. You want to gradually increase specifically those fruits and vegetables that are rich in antioxidants like you mentioned. All right. Now, what are the biggest challenges, do you think, in aligning dietary advice with medical treatment?
Well, some antioxidant-rich foods can actually interact with medications because they can interact with the liver enzymes, specifically the cytochrome P450 system, so that can make certain medications build up in your system. A lot of medications like statin drugs, which people take for cholesterol, are eliminated that way. So if you're, like grapefruit, for example, interacts with it pretty strongly. So you want to try and avoid that if you're on those medications because it can cause the medicine to build up in your body, which can, potentially have some toxicity to it. Another one is, we keep talking about dark leafy green vegetables, and while they're great, they're also rich in vitamin K. So if you're on certain blood thinners like warfarin, it can actually inhibit the how well that works in your system and not thin your blood as well as it should. So it's okay to eat some of it. You want to stay consistent with it. Basically, you don't want to go out and eat this giant salad when you're not used to eating all that. Just stay consistent daily.
Right. I think there is a misconception. We talk about misconceptions around nutrition, but I think around that recommendation in particular, because people hear, oh, vitamin K can conflict with statins. It interacts, so they avoid it completely when they're used to eating this and enjoying this really nutrient-rich dark leafy green salad. But in reality, the consistency is the key there when it comes to vitamin K, because then pharmacist, primary care provider can help kind of adjust.
They'll adjust your dose based on your labs. And I mean, if you're used to eating 2 or 3 salads a week with that, great, keep doing it. Just stay consistent doing it. Don't eat one every day, or don't just increase it. So just stay consistent, and they'll adjust your dose to work for you so that you can keep eating healthy and then also have your medications as well.
Yeah, absolutely. Well, I think this has been a great conversation. It's also been a bit of a whirlwind. We've kind of touched on a lot, from simple tips to kind of what food as medicine is, but I think this has been a great introduction to talking about food as medicine, some simple tips for getting started and incorporating some of those more nutrient-rich foods, either if it's for prevention or maybe as kind of a therapy if you're suffering with certain diseases. But I do want to reiterate the importance of speaking with a primary care provider. If you have a dietitian, speaking with your dietitian, with your pharmacist, clinical health coach about making some changes to your diet and what that could look like, certainly before adjusting any sort of medication. And then we talked about pharmacists and dietitians working together, Food City offers the Wellness Club to our loyalty members. So you can sign up for the Wellness Club and you'll get custom recipes from dietitians. You'll get articles and tips from pharmacists like Megan and from myself as well as special savings on certain supplies and medications. Well, this has been fun, and we'll see you next time. Thanks for listening.